My name is Eric Biegansky. I live in Hinsdale, Illinois, so western suburb of Chicago, with my wife and my two kids, Ryan and Emma, both 12 and 9 years old, respectively. So my initial cancer diagnosis was in October of 2008, so almost 5 years ago. I had some minor symptoms related to fatigue and lack of energy and some internal bleeding, which led me to have some tests and some CT scans. Based on that, they found a 11 centimeter primary tumor in my stomach, which they confirmed from the diagnosis as GIST, that had metastasized through my bloodstream into my liver. So that was the initial diagnosis back in October 2008. Well, as my initial team of doctors informed me upon my initial diagnosis, they told me that I was reasonably fortunate that GIST was being treated at the time by Gleevec, which is an oral chemotherapy drug. So gave me the opportunity to immediately start taking the drug. So for approximately the next 2 years, I continued to take the drug that initially led to shrinkage of the tumors, both in the stomach as well as on the liver, and basically manage it as a stable disease as best as it could. So that was my experience with Gleevec, which was my exclusive therapy for the first couple of years. After a couple of years, though, a couple of things happened at once. One, the Gleevec stopped being as effective as it could have been, which is not unexpected always with some patients, where your body starts figuring out, becoming a little bit immune to the drug. And then secondly, I started to get second opinions with other teams of doctors and specialists in the GIST field. One of the reasons why I'm sitting here today, because that led me down a path that was a little bit more aggressive and involved more surgical techniques to complement the drug therapy I was taking at the time. Well, when I first got a few different opinions, it was actually a physician out of New York, out of Memorial Sloan Kettering, who recommended that I go get the primary tumor out of there. Thought I was relatively young and healthy, I'd be a good candidate for aggressive surgery like that. It hadn't been completely proven out surgically that would work well for the GIST cancer that I have, but they thought it was definitely worth a shot. So through a surgeon here in the Chicagoland area, I had the primary tumor taken out, so a partial gastrectomy. And the point of taking that tumor out was, if we can get that out to negative margins, then we can really focus on the liver, where I still have multiple metastases and tumors across both the right and the left lobe. So once I had recovered from that surgery, I started exploring my options around interventional radiology or the liver treatments. And through a contact I had in Hinsdale, actually, who specialized in interventional radiology, I had a chance to get acquainted with his team, and I went through 2 rounds of surgery or yttrium radioembolization treatments. And then just recently, back in the end of February, I went through chemoembolization, sort of a different type of the same procedure, but with chemo versus radiation, that went after the left lobe, because some of the tumors on the left lobe had started to grow again and become a little bit more active. So from the liver treatment standpoint, I've been gone through the yttrium as well as the chemo. And then on the systemic side, which is more the drug treatment, I've been through a couple of additional drugs, because I mentioned the Gleevec before. Then I switched to Sutent, which I took for about a year, which worked for about a year, although I had a lot of difficulty with some of the side effects on that drug. And now I'm on a new drug called Stivarga that just got approved back in October and November by the FDA. So those are my 2 kind of modes of treatment that I'm going through right now. But I'm speaking also as a cancer patient and a survivor. I personally think there's something kind of empowering about it as well, to really give you a certain level of confidence that you have a medical team that is really aggressively fighting it. And maybe that's me, maybe it's my psychological makeup to really feel like when I'm going through a surgical procedure like that, I'm kind of going on offense, and it really feels like, rather than in my case, waiting and hoping for a 3-month scan that the drug is still working, to basically have that surgery that again is it's not curative. I'm not naive about that. It's palliative to really keep things stable. But like I said, I had my first procedure back in 2010, and everything seems to be going pretty well. So it gives me a lot of hope. Things that I'd like to tell other survivors, I think there's a lot to be said for how you get through something like this. Like I mentioned before, I'm going on 5 years now, and if I remember the first year, and I'm sure a lot of other cancer survivors feel the same way, but there was a lot of shock, a lot of fear, and a lot of kind of just trying to figure out how to process all of it, both physically but certainly more almost emotionally. Not only for myself, but for my wife, who's been my primary caregiver and support system, and my family as well. So I think working through that and dealing with the fear, which in my case, from my experience, was a little bit less about the fear of the cancer itself and some of the physical issues I'd be dealing with. It was more about the fear of my future potentially being taken away from me and what I'd be leaving behind and what the GIST cancer could potentially do to take my life away from me and my family. So once I got through that, my personal recommendation or advice to other survivors is not only to definitely be very proactive of serving as your own advocate and researching a number of different options available to you, not relying exclusively on the first medical team that you have to be working with. So be very aggressive at casting a wide net around different options. And I'm speaking just on behalf of my story because I've had the benefit of medical teams in multiple places: University of Chicago, Northwestern Memorial, where I had my primary surgery done, and now I'm being seen locally in Hinsdale, which works out very well and conveniently for me. So I don't want to come across like a high-maintenance patient that I've switched around so much. It's been more of the course of treatment that I've chosen and the specialists that I've gone to. So the reason I mentioned being your own advocate, where I derive a lot of strength and confidence and my ability to cope with all of this, is not only being my own advocate, but as we talked about before, having that comfort level that I have a very competent, capable team that is always not only looking out for me, but very qualified to always look at the latest wave of treatments available to you. And on a personal note, the gentleman, Frank, who's the doctor who I've become very good friends with, he first put things in motion when he hooked me up with the initial surgeon and started talking about yttrium. He was the guy that sat me down once and he said, "Eric, we're not really sure where this is going to go." I mean, when I first started looking at additional options and talking to other people, I was maybe 6 months into GIST, and the specialist in New York told me on the phone, he's like, "Yeah, you probably got about 5 years." And he was just looking at my scans, he was looking at the results of the Gleevec. He's the GIST expert, the foremost one in the country. So what Frank told me was, I just want to be at a point where if we ever get to a stage where I have to sit down and tell you we've done all we can do, then we've done all we can do. And so it's something that really stuck with me, because it's something that for the people that are important to me, my friends, family, wife, and kids, that I want to make sure I leave everything on the table. So these types of treatments that we're talking about, I think, are a good metaphor for when you're talking to other survivors to say, be very proactive, assert yourself, be your own advocate, and always feel like you're taking every option potentially there. Because not only does that have a lot to do with your physical recovery and treatment, but I think it has a lot to do with psychology and your emotion and coping with your fears. I just like to sum it up by saying yes to hope and how much that's meant to me, both in terms of my faith and my family and my friends. Like I mentioned before, back in 2009, it was a little bit tough to process, not only dealing with it, but you never want to talk about timetables too much. You're not a number, right? And but it still sticks in your head a bit. And then you think about, wow, somebody told me 5 years, and it's going to be 5 years for mid-October, and I feel like I'm doing pretty darn good under the circumstances. But when I say yes to hope, it means a lot to me, not only in terms of getting through life and living life the way I'd like to, but also getting to a point where I can see a little bit further down the horizon. And when we think about treatments like the ones I've been through, again, things can change in a couple months, and I'm not naive that I'm ever going to say I'm in control of this cancer, but it gives me a chance to say, you know what, I can envision a little bit of a longer term future with my family. I can plan that out. I don't have to start thinking about, am I going to get through my kids' high school, if you will, right? So that's what's exciting to me, and that's why I feel very blessed and fortunate to have access to these types of treatments, and it gives me a chance to really say yes to hope.